Right. Welcome back to the Empowering Minds Mental Health Podcast. Today we are joined by Dr. Andrea Niestas. So, from what I've read, you spent many years working in behavioral health and supporting people in their mental wellness journeys. And now you're doing some coaching and helping people move forward towards purpose and fulfillment in their lives. So, again, welcome. Thank you so much for agreeing to come on today. And so just to start us off, can you tell us a little bit more about your journey and what led you to doing the work that you're doing now?
So yes, all of that is correct, and thank you so much, Jennifer, for having me. I really appreciate it.
Mm,
So I first started in behavioral health. I worked 25 years in behavioral health, and 20 years of that was in a behavioral health hospital. So inpatient setting, like one of the most high crisis situations that someone could be in, the behavioral
mm,
health inpatient hospital. So generally, people would stay there anywhere from a few days to a few weeks. And so I did that for 20 years. And then I left that job just because I moved and I started teaching psychology at a local college. And then from there, had always been interested in doing life coaching. So then I decided, why not? I'll do teaching part time, try to do some life coaching. And so that's what I've been doing the past few years is trying to help people, just like you said, be more fulfilled instead of feeling like they're drudging through the Monday through Friday just to get to the
mm.
weekend. How can they during the week and any given day be more fulfilled in their life?
So, talking about mental health, when people hear the term mental health, sometimes they assume it only applies when someone is struggling. So, from your perspective, what does mental health really mean in everyday life?
So that's actually a very good question because there is, uh, in theory, technically, yes, you're talking mental health and you're talking mental illness, which
Mm-hmm,
are technically two different things. So Mental Health
mm-hmm,
Awareness Month is May. Mental
mm-hmm,
Illness Month, Awareness Month is in October. So when you're talking mental health specifically, you're looking at how people can be more healthy in their lives. Whereas mental illness, you're really talking about awareness around disorders and treatment and stigma and all that kind of thing. But to answer specifically about mental health is really looking at what someone can do to prevent a mental health illness or a disorder. So
mm-hmm,
just like if you go to the doctor for a physical reason, it's time for my annual physical, you're checking on your physical health. And so the
mm-hmm,
doctor may say something like, you know, you're predisposed to diabetes because both your parents have it. So in order to avoid you becoming diabetic, this is what you need to do. And so
mm-hmm,
really that's what mental health is. You're trying to prevent something before a crisis comes along. So it could be that you're more predisposed to something because there's some depression or what have you in your family.
mm-hmm,
So in that case, you're going to be even more needing to pay attention and be aware and try to learn skills and things that you can do so that you don't go into that sort of crisis and then require treatment and intervention. So, what can you do prior to learn something along the way so you don't end up in that situation? So, that
mm-hmm.
really is what mental health means to me.
Oh, I'm so glad you said that. Because I tell people all the time, the same way they go to the doctor if they haven't
Yes.
been feeling well for a few days and
Mhm.
it's feeling off, please go to the doctor when you're not feeling well mentally. I mean,
A
it's
100%.
it's one
Yes.
thing that maybe you might just have one off day, but when it's like a
Exactly.
consistent cycle, yeah, please go get checked out. And
Hmm.
so that's also something that I see myself a lot working in mental health. And what I get is because there are a lot of stigmas around mental health, so sometimes
Hmm.
that makes people a little reserved about
Yes.
wanting to go to the doctor to get treatment or to look to see, what kind of preventative maintenance or things like that they
Hmm.
can do. Hmm.
Exactly.
Yeah. So now, in your experience working in behavioral health for many years, What are some signs that someone might be struggling that people around them may overlook?
So I'm going to give you a two-part answer to that. So first, there's going to be some very specific things. So people's mood changes.
Mm-hmm.
They're generally kind of happy, easy-go-lucky, and then you notice something in their mood, or they're
Mm-hmm.
more anxious. You might see changes in their patterns like sleeping, eating,
Mm-hmm.
concentrating, memory, those kind of things.
Mm-hmm.
Also, you might notice that they're going to be isolating more, or
Yep.
what we call apathy, like they just don't care. Like it just nothing, nothing is getting their attention anymore. They
Mm-hmm.
just don't really care. Also, if you see changes in either, it could be any domain, it could be school, it could be social, it could be family. So any sort of area that you see somebody's in school, their grades start dropping. So any kind of change along those lines. If you start noticing them doing things that are strange for them, so something that doesn't really make sense, something that's a little bizarre, a little off, like you can't quite put your, so they're just acting like way different than they normally act. So those are
Mm-hmm.
some very specific things that you can look for. But in general, I want to give global answers of what you're really looking for is their change and their behavior compared to how they were before. Uh,
Mm-hmm.
so, and then, there's, this could go on and on, but there's other things to take into account, cultural, religious, like any sort of contextual um, information as well. But in general, you're really looking at what is changed in them, how much has changed from the
Mm-hmm.
person that they used to be. So the first thing globally that you're really looking for is, are these things causing them some sort of distress? So now their grades are
Mm-hmm.
dropping and they're really freaking out because they don't know if they're going to graduate, if they're going to be able to get into college. And so is it them personally causing them distress or discomfort? So that's one of the
Mm-hmm.
major categories that we're looking at. The other category is just their overall impairment. Maybe they don't see it, but you see, like, hey, like you just got written up at work. You're
Mm-hmm.
not only did you just get written up, like you're still late. You're being late every day. Like you're
Mm-hmm.
not performing at work like you used to. And maybe they have that apathy where they just don't really care. But do they
Mm-hmm.
have some part of their life that they have some sort of impairment in and they're really not able to function that the way that they used to?
Mm-hmm.
And the third major area is, are they doing something that's dangerous to themselves or to someone else?
Mm-hmm.
So are they um, making statements about not wanting to be here no more? I wish I could just go to sleep and not wake up, or
Mm-hmm.
becoming overly aggressive towards other people. So if their behavior is putting themselves or anyone else in danger, and that's the third main area that you really want to look at.
So I'm glad you mentioned about work. This was some time back, maybe like 2008 or 2009 for me. And I didn't realize that two of my coworkers were really that in tune with me, right?
Mm-hmm.
So one of them pulled me to the side and asked me, was I doing okay? Because they noticed I seemed a little bit distracted. And I was
Mm-hmm.
going through some things with depression, but at that time I wasn't as vocal about it. Actually, be
Mm-hmm.
honest with you, I was kind of embarrassed, right?
Yeah.
So she says, well, I knew something was wrong with you. She said, because you always have your hair done in some type of particular style. And I noticed
Mm-hmm.
you had just been brushing your hair back and wearing it in a ponytail. And I was like, wow.
Mm-hmm.
So between both of those coworkers, they kind of tapped me into some local community resources. And
Mm-hmm.
that's what made me learn some coping skills. And then I built my way up to go into therapy because I wasn't quite ready then.
Yeah, yeah.
But that was just amazing that they were just that
Mm-hmm.
in tune. They knew something was different
Yeah.
in me.
And that's
Yeah.
and that's why, like at the hospital, we don't only take information from the person coming in. We're asking their
Mm-hmm.
family members
Yep.
because a lot of times the family members are saying things that they just don't notice. You
Mm-hmm.
know, they're just not in tune with it, or
Mm-hmm.
it's really just something that, again, like they're just not paying attention to. They're really just not focused. They can't concentrate.
Yep.
And so a lot of times people around you can notice a lot of other things that you're not
Oh, yeah.
necessarily aware of.
That's true. That's true.
Mhm.
So speaking of, many people, they want to help a friend or family member who may be having a difficult time in their mental health, but they aren't sure what to say. So, what are some simple ways that someone can start that conversation and offer support to help someone?
Well, I do a training on mental health education. So I'm going to go actually through the steps that I recommend in that
Hmm.
training. And so the first three steps are really preparation. So the first is to have resources available, just exactly what you said.
Hmm.
People stepped up and helped you. So having those resources, because what if someone says, sure, I would love some support, I just don't know what to do. Boom, you have your resources available. So the
Hmm.
first is to have something ready for them in case they say, yes, I want help. Um, the next is to decide on an opening, what you want to say to them. You want to come into the conversation as compassionate and caring. And so
Hmm.
the way that they did it for you was perfect. It's actually one of the examples I give. Hey, I noticed that something's different.
Hmm.
Is there something going on? Um, Another is, hey, I just want to check in. How have you been feeling lately?
Hmm.
Um, I, um, I want you to know that I'm here if you ever want to talk. So anything that leaves it more open-ended instead of, um, hey, are you having a hard time? No. Okay. It kind of ends the conversation.
Yeah.
So when you leave it open-ended like that, like I noticed you haven't seemed like yourself lately. How have you been doing? Gives them the opportunity to really talk instead of feeling like they'd rather just say no.
Right.
No, nothing's wrong. So being able to decide ahead of time how you want to open up the conversation and be prepared. The last part, as far as preparing, is making sure that you set aside time where you have some privacy, you're not going to be interrupted and you're not going to be rushed so that you're able to actually have a conversation if they're willing to open up and talk. So
Hmm.
those are the three steps to actually prepare. So the first step is that you just want to approach the whole conversation with care and empathy. So just letting them know that you're asking because you're concerned, because you love them, because you notice that something's a little bit off, and just having that whole open and non-judgmental space for them. So that's really one of the most important things, is
Hmm.
to not pressure them to talk about anything that they don't want to, but just being there and being compassionate.
Hmm.
The second thing is just to listen to their story, but in general, just listen. Let
Yeah.
them tell you as little or as much as they want.
Hmm.
Um, Let them do it at their own pace. Let them share
Yeah.
what they want to. Don't try to diagnose. I think this is what's going on.
Yeah.
Don't second guess. Definitely don't want to get advice like, oh, well, have you ever tried this? Like my cousin did this and it like totally worked for her. You
Hmm.
know, Literally your job is to listen. So not to
Hmm.
jump in, not to give any sort of solutions in that way. You don't have to necessarily, you're not agreeing with them. Doesn't mean you're saying like, um, that you want to agree with everything they say just so that you can sort of be on track with them.
Hmm.
Mostly is really just about listening. Um, so sometimes even just repeating back to them, like, okay, so this is what I heard. This is what I'm hearing you saying, so that you really
Hmm.
understand what they're trying to say. And a big thing is just not minimize it. Like, oh, well, don't make such a big deal about that. Like,
Right.
okay, so your boyfriend broke up with you. Like, who cares? There's more fish in the sea. Like that sort of thing
Hmm.
doesn't help. Really, it's just going to be that listening to them. Third is encouraging them to seek help. So this is where
Hmm.
having those resources available is important, because if they say yes, you can offer to help them, but then you want to make sure that you're not taking it over. Like, okay, I
Right.
can call them for you. I'll get all the information.
Hmm.
Offer to help, but it's really, let them be able to be in control of it.
Hmm.
The next is to know your limits, to know what you can do and what you can't do. Um, and knowing that they might just say no, they don't want to talk, but it's nothing against you. Like you said, at one
Mm-hmm.
point you weren't ready, probably to have a full conversation. So
Mm-hmm.
just letting them know, though, that you're there and the door is open, maybe they'll be willing to come back later if you're giving them that space and that encouragement and listening to them.
Mm-hmm.
Then the last thing is to not be afraid to ask someone if they feel suicidal. And a lot of
Yeah.
times people are afraid to ask because, number one, the misconception, like you were talking about misconceptions, could be like, oh my gosh, I'm going to give them the idea to do it.
Yeah.
So that is a
Mm-hmm.
huge misconception, number one.
Mm-hmm.
And number two, then you might think, what if they say yes? What if they say, yes, I'm suicidal? Then what am I going to do? Right? So
Mm.
that's the scary part.
Yeah.
So I'll talk about that a little bit more later. But in general, for people to know that there is always the 988 crisis
Mm-hmm.
and your local 911. So if you
Yes.
ask someone that and they say yes, you have 988 that you can call, and they can help talk to the person, triage, determine if they're really in a life-threatening crisis,
Mm.
or 911. A lot of
Right.
cities have a clinician or a therapist that goes out with the police so
Yeah.
that they can assess someone in that situation. They'll call it
Mm-hmm.
different things in different cities. And not everybody has it, but at the very least, a police officer could come escort them to an ER if they really have to, you know,
Mm-hmm.
go that route. But really, it's just about knowing, letting them know that you're available. And even if they say no, they're not feeling that way, then it can give you some relief. And if they
Yeah.
say, yes, I've thought about it, then
Mm-hmm.
you know that they're really in a serious situation where they need some
Yeah.
help. So, but at the very least, knowing that you have those numbers to call, to not be afraid to ask that question,
Mm-hmm.
because you could be the only person asking them that. Because we
Yeah.
know we were talking about stigma, it's a stigma. People feel it's a stigma to talk about it, to bring it up. They still whisper about it when it does
Mm-hmm.
come up in conversation. So knowing that it's okay to ask them. And can you imagine someone feeling that way and somebody asking them and like, oh my gosh, finally can tell someone I don't have to
Yeah.
carry this around anymore. And it could be a relief for them.
Mm-hmm.
People say that I don't want to do it, but I'm afraid to do it. And I just don't know who can help me with
Yeah.
it.
Mm-hmm.
So if you're that person that can get them connected with some help, just triggering that question for them.
Yeah. That's true. I'm a QP for peer support team, and I do peer support, and I always encourage my team. That's one of the first questions I really want you to ask your clients. I always want to see that as your first sentence in your note that you assess for any type of risk or concerns.
Mm-hmm.
And I remember even starting out in peer support, I felt the same way. Like, I'm gonna ask them that. It just felt weird to say for me to ask someone were they feeling that way, but over time it just became
Mm-hmm.
something very
Oh, yes.
natural for me to
Uh-huh.
ask. And so something else, we were talking about like support. And something else that I noticed in peer support, sometimes clients have dropped out of
Mm-hmm.
peer support services because they said they were overwhelmed with support. And I was
Mm-hmm.
like, what? So I finally got to understand the other side. So for example, they may have therapy, they have their peer support specialist, they have a QP that checks in on them, they may have like the clinical director that checks in on them, and it just became just too
Mm-hmm.
overwhelming. Sometimes
Mm-hmm.
people just in general, they just want to just help. And like you said, they may say things like, well, when that happened to me or that happened to my friend, they did this, this, and this. And that might not necessarily be the support that that person is looking for. So as I have built relationships with clients over time, I ask them, what does support look like for you? Because I don't want to
Mm-hmm.
overwhelm them. So
Mm-hmm.
if they tell me, I prefer you to call me and check on me one week, and the next week, could you just text me? And that's how we
Hmm.
that is their support. And that's what I try to
Hmm.
follow so I don't overwhelm them.
Hmm. And you know what? That's actually an amazing suggestion. I might even add it as my last step here for future trainings. So when you're done with the conversation with someone, to say, what can I do to support you in the future?
Hmm.
Can I check in on you in a week? Can I text you tomorrow? Yeah, that's actually that's a wonderful way to end a conversation like this with someone.
Hmm. Yeah. All right. So I wanted to touch on this too. When someone realizes that they may need help, what are some professional support options that people should know about?
So I think a very good term for people to know is something called level of care. So a lot of times
Mm-hmm.
that's going to be used by insurance companies, it's going to be used by providers, and
Mm-hmm.
people don't always understand what that is. So level of care, the way I would describe it when I worked at the hospital, my department was the intake department. So we actually
Mm-hmm.
were the ones to determine the level of care. So I would describe it as it's the type of treatment that we think is going to be the most helpful for you at this point. So
Mm-hmm.
when they talk about lower level of care, like the lowest level is going to be like just a one-on-one therapist.
Mm-hmm.
The next step is maybe going to be a psychiatrist who's going to give you medications. And then from there, you have different like day treatment programs where you go like just for part of the day and then you go home. So they call those either IOP, intensive outpatient, or
Mm-hmm.
PHP, partial hospitalization programs, depending on how many hours those are. From there, like the next step is the residential. If someone goes
Mm-hmm.
into like a 30-day or a 60-day program where they stay there, for treatment, but that's considered a lower level of care than the hospital because it's usually
Mm-hmm.
less restrictive. You're usually able to maybe go out and for an outside appointment, maybe go visit your family. It's not
Mm-hmm.
what people call like lockdown, you know. So the highest level of care is going to be like an inpatient behavioral health hospital. And so that's where somebody goes in for 24-hour care every day. So
Mm-hmm.
um, they're usually staffed by nurses, psychiatrists, counselors. So someone actually stays in the unit in the hospital for a few days to a few weeks. So
Mm-hmm.
those are the different types of treatment. And even one clarification that I want to make for outpatient that I still see people making a lot of mistakes with is psychologists versus psychiatrists.
Oh
So
yeah.
a psychologist is a therapist who has a doctorate degree. So they could be called Dr. Smith, but they're a psychologist, meaning you go when you talk to them about your problems.
Mm-hmm.
Dr. Smith, who's a psychiatrist, actually has a medical degree, and they're the only behavioral health professionals who can give you medication.
Right.
So, besides a psychologist, there are other different types of therapists.
Mm-hmm.
So, like a LMFT, licensed marriage family therapist. Usually, most of the other kinds of therapists have a master's degrees, like
Mm-hmm.
LCSW, licensed clinical social worker.
Mm-hmm.
But in general, it's only going to be a psychiatrist who can provide the medication. What we would see a lot at the hospital is that individuals were getting their psychiatric medications through their primary doctor,
Mm-hmm.
which was something that we usually didn't recommend because they're just not specialized in that area.
Right.
So it would be like if you had a heart condition and instead of sending you to the cardiologist, your primary doctor said, "Oh, don't worry. I know some medication that'll help you." Are you going to feel more
Right.
comfortable getting your cardiac medication from a cardiologist or from your primary doctor?
Mm-hmm.
So it's like exactly the same thing. We always recommend that someone go see a psychiatrist because a general doctor just isn't as versed, especially
Mm-hmm.
with new types of medications coming out. And
Mm-hmm.
they're sort of just looking at the whole, they have so many people coming through. A psychiatrist can really focus more on the specific issues that you're having.
Mm-hmm.
So those are the different types of treatments that are available for people.
Okay. I'm glad you said that because I went to my primary care and and she's great at what she does as far as my primary care stuff.
Mhm.
And I was
Yeah.
sharing with her some things that were going on, and she wanted to prescribe some different things. And I was
Hmm.
like, wait, I'm really here for you to give me a referral for
Hmm.
behavioral health.
Yes.
And I looked at her and I was like, I hope I didn't offend you because you are a great doctor, but I
Hmm.
want like a specialized doctor. I want a specialist.
Yeah,
And I think that's something that probably happens quite often that people may use
exactly.
their primary care for behavioral management. But I
If
just
you,
wanted a referral.
yeah, if you had rheumatoid arthritis, do you want to get your medication from your primary doctor or from a rheumatologist? I
Right,
mean, that's what they
absolutely.
do all day long. You know, they know
Mm-hmm.
the combinations of medications that work best for people. That's what they do like every single day,
Yeah.
as opposed to your primary doctor does about this much of it every day. So, like you said,
Mm-hmm.
they can be an excellent doctor. They just don't have as much experience in it. And so it's really important to not use or expect a primary doctor to know as much as a psychiatrist who's going to
Yeah.
be a lot more knowledgeable.
Mm-hmm. Mm-hmm. So you mentioned earlier about, let's see, mental health awareness is in May, and then you said mental illness awareness is in October, correct?
Yes.
Okay.
Yes.
So as we recognize Mental Health Awareness Month, which is upcoming in May, what is the one thing you wish individuals and families better understood about mental health and getting help?
Um, I would say two things. And so the first is that psychological disorders are not uncommon. They
Right.
are common. The most latest statistic is every 3 to 4, in a group of 3 to 4 people, statistically, one of those individuals is going to have some sort of uh, mental health diagnosis or disorder in any given year.
Oh, wow.
So that is about 25 to 33% of individuals. So I honestly, I just say about a third. About a third of people in any given year are going to be diagnosed with some kind of a psychological disorder. So
Hmm.
knowing that, again, knowing that a mental health condition is going to be just like any other physical medical condition.
Mm-hmm.
It's gotten to the point recently, probably at least within the past decade or two, that health insurances are now recognizing the same thing. So they consider a mental health diagnosis or a mental health crisis to be the same as a physical emergency crisis. So knowing the prevalence of it and knowing that it is common really, I would hope, would help remove some of the stigma for individuals.
Mm-hmm.
And then on top of that, knowing that because of that, because it is something that happens to so many people, that there are resources. So
Mm-hmm.
one of the things that I wanted to mention, I talked a little bit before about not being afraid to ask those questions about
Mm-hmm.
if someone was suicidal. You probably have heard about the CSSRS, the Columbia Suicide Severity Rating Scale.
Mm-hmm.
So that is one of the most common assessments that people use now to determine if someone is suicidal or how much of a danger, imminent danger they are to themselves. So this scale is something that is used by police departments, by hospitals, by it is like I said, one of the most commonly used. And the amazing thing about this tool is that you can actually go onto their website, watch a video, learn how to use it, and then anyone in the community can go out and ask these questions. I know that there's like little cards available. Some I've actually seen people print the questions on a small piece of paper and stick it in their wallet and have it
Oh.
available. Because what it is, it's only 6 questions. And the first 2 questions, depending on what the answers are, will determine if you even have to ask all the other questions. So, for
Mm-hmm.
example, the first question is, have you wished you could go to sleep? Have you wished you were dead or wished you could go to sleep and not wake up? So if someone says no to that, then you ask, have you actually had any thoughts of killing yourself? And if they say no to both of those, then pretty much you just jump to the the last
Mm,
question number 6, because they're really not at imminent danger. But if they say yes to those, the form shows you the next questions to ask, and it tells you right there on the form if someone's at high risk. So once they hit
mm-hmm,
high risk, those are the people that you probably want to call 911 and say, okay, I'm really concerned about you. And
uh-huh.
so I'm going to make this call so that someone can come out and help us. So literally anyone can go onto the website, do this training, learn about this tool, have the questions with them at any given time, because you just never know. And I actually have seen, I can't tell you where, I can't remember, but the actual like business, business card size of these questions as well. But like I said, people have made them on their own. So knowing these questions and learning how to ask them and what they mean
Mm-hmm,
can really alleviate some of the anxiety and stress that people might have in answering those questions.
mm-hmm,
So that is the Columbia Suicide Severity Rating Scale, and it is through, you go to cssrs.columbia.edu. And there's also another training that goes over just mental health in general. It's called Mental Health First Aid, and it's through
yeah,
Mental Health America. And I believe
mm-hmm,
that one's a 4-hour training.
mm-hmm,
And I think you can do it online. I know they're in person, but I think you can do it online.
mm-hmm,
And that one is mentalhealthfirstaid.org. And
mm-hmm,
so that will give you a lot more information as well. If you want to be even better prepared, if there's someone specifically that you have in mind, or you've already had experience with this in your family or someone close to you, and you want to get just more information on how you can be prepared to help them or be able to understand what they're going through, that's another really good training. So those are the two things to know, that psychological disorders are not uncommon and that there are ways for you to be able to get knowledge and get information. There's a lot more knowledge to be had, but those are the ones that are specific trainings.
mm-hmm.
And I do have some of my favorite referrals that I like to give as well. So do you want me to share those now or later?
Yeah, yes,
Okay.
ma'am.
So some of the other favorite referrals that I have is I have a list of different crisis lines. So that one's
Mm-hmm,
too long to go over. But anyone that goes to my website, you can just send me a message and I'll send it to you. It's specific to like teens, one for like veterans, one for
mm-hmm,
LGBTQ community. So I have like a very long list of all the different crisis lines. But also in general, so I mentioned Mental Health America.
mm-hmm,
That's one. MHAnational.org. Um, the National Alliance on Mental Illness, also known as NAMI. So
mm-hmm,
that's NAMI, NAMI .org. And there's a lot of local NAMIs, like the one that we
mm-hmm,
have here is NAMI Kern County. But there's generally like a local one, or you could follow the national one if you wish.
mm-hmm,
There's one called Take Action for Mental Health, and that is take action, the number 4, mh.com.
mm-hmm,
And then the last one, if you're looking specifically for information on suicide prevention, the American Foundation for Suicide Prevention, which is afsp.org. So all of these organizations, all of these websites have a tremendous amount of information. And it might, like you're talking about feeling overwhelmed, a lot of it can feel overwhelming,
mm-hmm,
to even like browse their websites. Even as I'm trying to gather resources, it's like it's a good thing. It's like it's so much information, it's overwhelming.
mm-hmm,
So you really, really just like take, just really take what you need. You don't
yeah,
have to go through the whole website. You don't have to go through all of them. But just know that they're there and they really have a tremendous amount of information that's very, very helpful to people.
mm-hmm. Yeah, you mentioned NAMI. I push that one a lot. I'm a member of my local affiliate. I serve on the state PLC too. But I'm glad you mentioned about the mental health and first aid because I need to check. I took the adult and youth and it's about
Mhm.
time for me to recertify. So I'm glad you said that. But that was like I enjoyed both of those classes. Some of it was well, my particular class was hybrid, but I learned so much. So I encourage others because a lot of times, if you search, a lot of times the classes are free, and
Mm,
so that is a good certification to have. So thank you for those resources too,
sure.
and I'll make sure to include them in the description. But
Okay.
so for the last few minutes, you mentioned about your website, and so I want to allow you time to give your contact information, your website information, if you've written any books or any articles or anything that you would like to highlight, you can do so at this time.
Okay. So, excuse me. So my website is lifecoachingbyandrea.com. And so I have information there on the individual coaching that I do that I was telling you earlier about people who are really looking to have that life fulfillment.
Mm-hmm.
But I also do workshops on a lot of things related to wellness, but like I have a workshop on mental health education. So a lot of what we
Mm-hmm.
talked about is what I do in the workshops. So I do workshops on self-care, living a more fulfilling life, meditation and mindfulness. So yeah, if you go to my website, you'll be able to see all of that. So I
Mm-hmm.
do workshops via Zoom as well. So
Okay.
you could be anywhere, and we could definitely get something scheduled. You can find me on Facebook, TikTok, no, yeah, TikTok, Instagram, YouTube, and my name on all of those is Life Coaching by Andrea.
Okay.
But if you wanted more information about anything that I mentioned, like I do have, and you know what, I can email you too so that you have it. I have a list of those crisis lines,
Yes.
so that I can send that out to anyone who's interested. But anyone who would like a workshop on more information, or even just
Mm-hmm.
a one-on-one caregiver advocacy
Oh yeah.
coaching session, I'm available for those as well.
Okay. Yeah, that's another area. Caregivers.
Hmm.
It's it can be a lot on them. So I'm glad you did highlight that. So maybe I know a couple of caregivers. Maybe they will reach out to you to maybe we can get something set up for a workshop for that because they need support as well.
Oh yes, and
Hmm.
like you mentioned, NAMI is a great resource for that too. They have different
Hmm.
caregiver groups,
Yes, they do.
virtually and in person too, if you have a
Yeah.
local one near you.
Hmm. Okay. All right. So again, I just want to thank you for coming on to the podcast today. I strategically named it the Empowering Minds Mental Health Podcast. And I'm strategic in who I invite because I want them to help me empower others, inspire them, provide education around stigmas. At the bottom, it says listen and grow. And that's what I hope when people listen to my podcast that they listen and they're able to
Hmm.
grow, whatever that looks like for them in a
Yes.
positive way. So thank you again for coming on.
Okay. Thank you so
All
much for
right.
having me.
Thank you. I'll be in contact with you soon.
Okay.
Have a good evening. Thank you.
Thanks, you too.
Bye-bye.
Bye.